I'm Patrick Vernon. I'm Associate Director for Connected Communities at the Centre for Ageing Better. It's really fantastic to contribute to the National Lottery's conference on unequal communities, the impact of COVID-19. The Centre for Ageing Better, we've been in our sixth year now, and we're a national research think tank organisation, part of the various networks in Britain that's trying to collect data and information on the impact of COVID-19. But for us, we look at it through the lens of ageing. So I just want to share some information, some research work that we've done recently. And just in terms of the work of the centre, we have four key priority areas around ageing in Britain. And we look at the age ranges between 50 to 70. We look at health, fulfilling work, homes, and community participation. And what we've noticed is actually the impact of lockdown and the COVID-19 has a massive impact on all our four priority goal areas, and was the issue of conversation that we're having in Britain around ageing and its disproportionate impact on a whole range of communities and reinforcing inequalities. In terms of context of lottery events and communities, we saw for the first time that there was a surge in community activism, participation, mutual aid societies, but at the same time, people were still missing out on this. So through working with a whole range of organisations such as the Physical Society, Ipsos Mori, the King's Fund, NatSen, the Manchester Urban Ageing Research Group, the Learning and Work Institute, and the Institute of Physical Studies, we've been able to pull together a range of data over the last several months, and we've been sharing a whole range of our interim findings, which you can find on the Centre for Ageing Better website as well. Just to show you some data regarding around the aspect of communities. So one of the key things that we wanted to find out was a sense of belonging and how people felt during the lockdown. And as you can imagine, that what we looked at the age ranges of 50 to 70, we found that some people, about 10 to 20, just under 20% felt they were living comfortably, but a lot of people really felt that they were struggling because of the lockdown. On another sort of slides that we had, looking at how people felt if they felt well off, I should say. Some about 60% of people felt they were doing all right, okay, and a high percentage, 70, were living comfortably. In terms of the question that we asked about how people again felt being well off again. Again, very high proportions of people feeling about right or living comfortably as well. These are kind of obviously general figures, and obviously this will be different depending on particular protected characteristics, such as black and ethnic minority communities, women, people with disabilities, mental health problems, etc. In terms of one of the slides that about we measure the whole stuff around how connected you are to your community. Again, we found that about 80% of people felt that they knew someone or could count on someone for help, maybe a friend or a neighbour or someone in their vicinity. Roughly less, about 60% felt that they were aware of a community group or organisation for assistance. And roughly just under 6% also felt that they knew people in their local vicinity, and about the same figures that people had a sense of belonging to their neighbourhood. So in many ways, I suppose the lockdown has further reinforced that localism in impact as well. However, if we looked at how we add in this measures around belonging, sense of belonging in your neighbourhood, with how well off they've been, then it's a bit different. Some people, about over 50% of people, found it difficult to find difficulty by getting by. When it came to about again knowing their local community groups, again people found difficulty to know who they were at times, and also about their local area. So you've got this juxtaposition where on one level there's a high degree of people have a sense of belonging, but when people want to find out where they could go for assistance in terms of community groups or mutual aid support or sense of belonging, that declined. And in many ways, this is quite interesting because I think if you were to just look at the issue of impact of COVID-19, particularly on Black and Asian minority communities, then what's quite another, and people have been housebound or been shielded, LGBT communities and people with less low incomes, I think this is probably exacerbated. And we're doing more research work to find out more about these nuances. But what's quite clear that we can see from the evidence over the last 10, 11 months, and plus the work I have been doing as Associate Director and work with a whole range of organisations and the wider kind of work around amelioration and impacts of the pandemic, that that obviously not only because of the impact of restricted activities, but obviously people have not been able to practice in terms of their religious practices and particularly faith communities, people who used to go to a whole variety of social activities, interactions. That's not happened. There've been definitely, what we found is definitely the loss of community impact, contact for those communities from Black and Asian communities as well. And obviously this has had an impact on services. More services have been done online, but obviously there's been a great reach for people to try and do stuff online, but also we recognise there is a potential digital divide that's kind of also happening as well. This diagram, which you can see, was produced by a graphic facilitator, Dr. Pen Mandoka, and it kind of captures the impact of inequalities around BME communities. And what's quite clear that that current inequalities in society, such as the impact of hostile environment and wider immigration policy, the impact of inequalities around health, education, employment, also has further intensified as well. So this is quite clear that there is unequal society in the way currently how COVID pandemic has played out, and the work of funders, including ourselves working with the lottery and a whole range of organisations such as the local government agencies, LGA and other agencies, we all need to come together to see what we can do to reduce impacts and working with government and get more additional resources and to create more opportunities for co-production, co-creation and for local communities and for people who can be part of that solution process as we move towards a recovery period. Resilience is going to be at the heart, as well as the wider work around public health, and particularly the work that we are doing in our wider priority goals around health, education, employment, and housing. All these are quite they're linked together, and it's like making sure that communities, that we need to kind of stop that inequality gap. Otherwise, this could have further repercussions on people's quality of life and how they can get the type of support that they need. Funding is going to be even more critical. Targeted funding is going to be more important, but it's making sure that local communities have a greater way of influence in how we do the decision-making processing, and research and evidence work that we're doing along with other organisations can add value and make a difference as well. I hope you enjoy the rest of the conference, and more importantly, let's have this dialogue, let's continue this conversation, and please go onto the Centre for Aging Better website for more information about all our research work and all our campaigns that we're doing around age discrimination. Thank you very much.